So in a break with formality, Brenda and I are going to stay seated if the camera lady back there doesn't object. So I think there's been lots of really interesting thoughts presented over the last 2 days, and I guess this is the role of this panel to try to pull some of these things together and figure out where do we go from here, which is really going to involve, I think, all of you to help us get there. So I'm going to offer a few high-level thoughts in terms of where, from our perspective, perhaps from a government perspective, we see some of the opportunities, and maybe throw my perspective on where the private sector may see some opportunities. Then some of the challenges that as we develop the next generation of partnerships, and I really think that's where a lot of the opportunity is really looking forward, what some of those challenges are, and then suggest a few areas of exploration for the forum. So first, on the opportunities, I think it's very clear from the discussions we've had over the last 2 days, and certainly what we all sort of bring to these, our knowledge that we bring to these discussions, is that there's a real opportunity both from the public sector and the private sector. Certainly companies can have a significant impact in taking on global health challenges or development challenges, and we've seen many examples over the past 2 days where that's the case, whether we're talking about women and children's health, HIV, talking about disaster and emergency responses such as Ebola. Then we had a lot of conversations around strengthening health systems, and Ebola, certainly we were just talking in the hallway earlier today how Ebola may even shift the pendulum more toward health systems, because that really has been such a sort of glaring part or missing part of the of this Ebola story. We also know the private sector has unique ability to contribute, and we often think about how private sector can create financially self-sustaining solutions to challenges, and that is perhaps an important role that private sector can bring to some of these partnerships. And then we also know that different industries are well placed to be able to help a range of unmet needs. And so thinking about, there's opportunities to think about how to leverage companies' different unique assets that they have to offer. So certainly one area of an opportunity is that there's an opportunity for companies to have a significant impact. I think another opportunity is that we really have seen a sort of increasing alignment of incentives, both on the public sector side as well as the private sector side. So from the public sector, and we just heard Dr. Shaw's strong interest. We're seeing public-private partnerships is the wave of the future. I mean, I think there has been a very significant recognition over. This is not new to development, but certainly sort of increasingly so, of that how aid must leverage private resources to achieve maximum outcomes across development. And I think everyone is well aware of the sort of seismic shift in where donor dollars have been moving. So U.S. contributions to developing countries several decades ago was really the majority of dollars going into developing countries, 70% or so of the dollars. It has now shifted, so it's only about 9% of the contributions. So that shift, which is huge, completely changes the dynamic. So as we sit from the public sector side and think about our role and our ability to influence public sector outcomes, when the majority of the contributions coming from the U.S. going into developing countries are actually on the private sector end, how do, if we want to be successful, how do we better leverage those dollars in ways that can really help us achieve sort of our larger development objectives? So I think that's helped us open up and think about how we can look beyond the traditional operating models. And so Dr. Shaw talks a lot about the new model of development that absolutely recognizes this sort of dual role that has to be played to be able to achieve our development objectives. From the private sector, where the incentives are, I think has also shifted. So I've been working in global health for about 10 years, spent a lot of time working on how to incentivize companies to develop medicines for developing world diseases. And just even in the last decade, there has been a significant shift in how pharma, medtech companies are looking at some of these markets. Africa is now the largest growth market, is going to be one of the largest growth markets in the world. And as companies are looking at the sort of shrinking opportunities in the U.S. and European markets, the real growth opportunities are in these emerging markets and in African markets as well. So I think the pharma spending in Africa is expected to reach $30 billion by 2016. It will go up to $45 billion by 2020. So huge opportunities there and interest in sort of how to take advantage of it. It's the new frontier. So we've certainly seen many companies starting to align their efforts to figure out how to best take advantage of these opportunities. So these two sort of aligned interests, I think, then really opens up the door to us thinking about that shared value opportunity in even new ways than we have before. And so we think about, so there's opportunities for mutual learning. So as these companies try to move into these markets that are some new territory, you've got the development community that's been in there for a very long time and knows a lot about how to operate in these markets. From the global health side, we certainly can learn a lot from the private sector in terms of leveraging the rigor and well-defined processes around design and introduction and scale and how to even understand markets well. And so I think there's companies can also look at this. There's opportunities to think about how companies can create short and long-term value for their businesses. But doing so may even require some of these companies to look at different business models as to how they reach these new markets, how particularly as you start to think about how you reach further down the bottom of the pyramid, it may require new business models, and that's where I think working with the public sector can help. And finally, I think there's sort of growing opportunities around the value of multi-stakeholder alliances, and there's been lots and lots of examples, successes and failures of sort of more traditional partnerships that are perhaps sort of bilateral partnerships, and I think we're seeing more and more multi-stakeholder partnerships, and is sort of an interesting area for exploration. So in terms of the challenges, as we begin to try to think about how we can build the next generation of partnerships, I've got 4 different challenges. One is around strategic alignment. I think we've heard a lot of that's come up in conversation over the last 2 days. How do we ensure alignment of different objectives of the different parties at the table, and that's a critical piece. Second, and you heard George mention this earlier, is around measurement and evaluation. And we need to, from our perspective, we've been very good at talking about measuring leverage, and we can sort of hang that leverage banner out there and talk about how we've leveraged private sector resources. But we need to go beyond that, and we need to get better data on partnerships to determine what approaches are delivering the sort of the most effective development impact, and if so, how do we replicate those? How do we better understand how to replicate those? And so it is an area that I think we're lacking a lot of information. Third is on scale and sustainability. So we often talk about partnerships with the private sector as having that great potential to bring in that long-term sustainability. The private sector is really good at scaling, and so by having them there, it's sort of as if it will magically help us scale many of these partnerships. But I think in actual fact, when we look at many of these partnerships, that many of them are still struggling to scale beyond that sort of initial pilot, an initial period of commitment, and how do you sustain impact over time? And so we need to learn more about how we can incorporate scale and sustainability into these partnerships at the beginning, so that they're not just these one-off pieces, but they are some things that can have longer-term impact. Some of them are meant to be ad hoc one-offs, but I think if we're looking for that bigger impact, we have to think about how we build that in early on. And then finally, just going back to this idea of multi-stakeholder models, is that we firmly believe that if we are going to tackle some of the most ambitious development challenges at scale, we need to start thinking more creatively about how to build these multi-stakeholder alliances and bringing the right people to the table. That raises some real challenges, because these multi-stakeholder alliances are by nature complex. They're difficult to design, to manage, and to implement. And so we need to better understand some of the ways that we can increase impact with these particular alliances. How do we reduce transaction costs with these models? What are some examples of governance models that work well for these kinds of alliances? Are there funding models that enable the multiple capabilities to really be brought to bear and kind of combined effectively? So those are 4 challenges, and I think within those there are some potential lines of work for all of us. But I just kind of bring into 2 key points, and I made these comments 2 days ago, but also just to kind of bring it all together is one is I think about how can multi-stakeholder alliances be used in ways that can help us overcome some of these challenges I just talked about, but also develop strategies to facilitate their growth. How can these kinds of alliances help us take on some of these larger development challenges? Where are the real opportunities for those as we can look to the future and look over the next decade? And then how do we better align incentives and align the sort of investments and growth strategies with our development objectives? And where are those opportunities? So really thinking about continuing to push the envelope and how we think about how we partner and where those big opportunities are. So I will stop there.
Very much. And Brenda, you want to wrap up?
So first of all, thanks very much for the opportunity to join this distinguished closing panel. I also just want to add my thanks and praise to the forum leadership and the planning committee for what I thought was an excellent workshop with great presentations, and I know I learned quite a bit, so it's been a really terrific 2 days. I oversee the corporate responsibility function at Merck, and for those of you who are not familiar with Merck, we're a global healthcare company that discovers, develops, manufactures, and markets a wide range of medicines, vaccines, biologics, and animal health products to help improve global health and well-being. The company is known as Merck in the US and Canada, but we operate as MSD outside of the US and Canada, which I know causes great confusion. We're also different than the Merck Serono Merck KGaA company, which is a different company based in Germany. So just to confuse people. Anyway, we have approximately 68,000 employees, and we operate in about 140 countries. So in terms of public-private partnership, the company has long believed that partnership is critical to addressing these complex global health challenges. I would say it's been a pillar of our approach for many, many years. And we have a long and somewhat strong history of partnership, dating back to the one that we're probably most known for, which is the Mectizan donation program, which was launched in 1987 for river blindness and now lymphatic filariasis as well. Since then, we've built on that partnership and engaged in many other types of partnerships, taking on a more complex global health issue like HIV through our partnership with the Gates Foundation and the government of Botswana. More recently, we launched a 10-year, $500 million initiative called Merck for Mothers to address maternal mortality. And we've also sort of put our toe in the water of those types of partnerships that are more along the shared value continuum with a project, for example, in India, where we are addressing or trying to improve education and Hep C treatment for populations that are challenged to afford their treatment by collaborating with a financial institution to provide financing and disease management. So like probably many other companies, we continue to wrestle with the creation of a robust portfolio of partnerships that includes both the philanthropic all the way to the other end of the continuum, which are partnerships which bring social value but also have business value, whether that's economic value, and I think that was a really important point that Sir George made, but other types of value like reputational value, building stakeholder relationships. So I think we have to be a little bit careful not to just think it's about the dollars, because we get a lot more out of these partnerships than just economic return. So what I wanted to do was just touch on sort of what we've heard over the past 2 days, and particularly what resonated with me, and then go on to a couple other points that I wanted to make. So in terms of public-private partnerships, what I heard were, first and foremost, partnerships are difficult and complicated, and I completely agree with that. But we also heard that partnerships can and do bring value. We heard that partnership is an essential approach to addressing complex global health challenges, and I think that's very true. That they vary. There's a lot of different types of partnerships, whether they vary in scope or objectives or governance or the partners involved. And we also heard that partnerships can, and some believe should, bring both social and business value at the same time in order to be more appealing and more sustainable. We also heard many, many lessons. I think that was what was overwhelming to me in the last 2 days, that there's so many lessons to be harnessed here. But I'll touch on a few of those which lead into my point about challenges. So we heard about the importance of community ownership. Again, I think Sir George made that point, as well as several others. And that's certainly a very critical element of a successful partnership. It's important for these programs to be defined by and meet the needs of the communities that they're meant to serve, and be owned and driven by local communities. We heard about the importance of shared goals and shared credit. We also heard about, and we've heard this a lot over the last 2 days, and this is something that resonates particularly with me, the importance of respect and trust amongst partners, and how absolutely critical that is in any type of partnership. We heard about the importance of achieving scale for greater impact, the importance of sustainability, whether the partnership needs to be sustainable, whether that's a successful dissolution of the partnership, or an evolution into something else. The importance of measurement, and I think Wendy really brought that point home. Measurement and evaluation is critical, and probably somewhat, I don't want to say ignored, but it's often an afterthought, and that needs to come more to the forefront. And then the importance of achieving shared value, which I thought Laura from FSG did an excellent presentation on talking about why that's important. So in terms of these lessons, we know that if we apply these lessons, we have a better chance of success in terms of other global health partnerships for health and safety. We learn from our successes, and we stick to what works in a certain sense, and best practices are really important. We also learn from our failures and things that haven't worked, and I actually think you learn more from your failures than you do from your successes, and that's a point I want to return to at the end. We know that there's a need to document both and utilize those learnings and share those learnings with others, and that's why a forum like this, a workshop like this, I think is so important, because of the sharing nature of it. But I also think we need to be careful not to rely on what we think might be a roadmap for success. So you can put together a toolkit, you can put together case studies, you can put together best practices, but every situation is unique. So I think we got to be a little bit careful that we don't think this is the end point. One thing that we didn't talk a lot about, we talked about partnerships being challenging, but I want to just spend a couple of minutes on how challenging it also is to apply the lessons learned. And I want to focus on 3 of those challenges. I'm going to call them the 3 C's. And those are changing existing mindsets, collaboration rising above competition, I'll call it that, and then changing partners, changing players, changing priorities, changing problem. So looking at the first one of changing existing mindsets, when we looked at or talked about elements that are critical for success, like community ownership, for example. We all agree that that's important. But I think that it's challenging sometimes, and I'll speak from a corporate perspective. I think sometimes companies think they know better, they can do it more efficiently, they can do it more effectively. And you don't always realize how important it is to step back and let the community lead, and how much you can learn by doing that. I mean, we have learned so much about public health, and we've brought that back into our business just from engaging in these partnerships and learning from the communities. So I think there's a learning opportunity there that is not always apparent, and therefore it doesn't allow for the community to take ownership. The one that I think is sort of, most important, at least in my mind, is the trust and respect one. So we know that partnerships can't survive without strong trust, and I think it's extremely challenging for organizations to overcome their biases, their organizational biases, to accept other organizational philosophies. And I want to give two examples of this. So about 12 years ago, we had a Merck retiree who made a personal monetary donation to Médecins Sans Frontières. We have a matching gift program. So we then sent Médecins Sans Frontières a check to match that contribution by our employee. As soon as Médecins Sans Frontières found out that that individual was affiliated with the pharmaceutical industry, they sent back his donation and our match to that donation. So that was 12 years ago. 2 months ago, we contacted MSF with a simple question. We know you're on the front lines of this Ebola crisis. How can we help? What can we do? What do you need? And we were told thank you, but no thank you. So we've made progress in the trust area, but maybe not as much as we thought. I'll give one other example. 13 years ago, at an event related to the Mectizan donation program, the Director General of WHO at the time refused to utter the name Merck. The materials that were associated with this event referred to us as the American pharmaceutical company that donates the drug. So that was 12 or 13 years ago. Well, let's fast forward to April of this past year. You heard Leslie Graham from the Gates Foundation talk about the London Declaration for Combating NTDs. And that's it's 13 pharmaceutical companies, WHO, the Gates Foundation, the World Bank. And Margaret Chan, was on the stage with us and talked about this effort and acknowledged, maybe didn't mention her name, but acknowledged the role of the private sector. However, when asked to take a photo with the 13 CEOs, she indicated that she could not do that because that would not sit well with her member states. And I actually think she said it more strongly than that. Now, you can understand that. You can understand where she needs to maintain a position of neutrality. So you can certainly sympathize with that. However, I don't bring up these examples to be provocative, and I don't bring them up to call out any particular organization. I bring them up to demonstrate that as far as we've come, we have a long way to go. And I think we certainly can do more in building trust and respect with one another. And I think from the corporate perspective, we would like to be viewed as a true partner, not just a source of resources, money, products, but we'd even like our expertise to be capitalized on when it's appropriate for us to be at the table. Just in the interest of time, the second one, collaboration versus competition. So I think we've evolved greatly here. You do have private-private partnership happening within public-private partnerships. GSK and Merck have been working together since 1998 to address lymphatic filariasis, and it's been a great partnership. We're competitors by trade and by nature, but that's an example of collaboration. Joe from UPS, the UPS Foundation, mentioned about collaborating with competitors around logistical challenges associated with the Ebola crisis. So you see that happening. But I also think you have to, as you think about shared goals and shared credit, you have to resist the competitive urge. The competitive urge to maybe, take credit perhaps more so than the organizations you're standing side by side with. So that's something I think we always have to keep in the back of our head, not to let competition take over. And one of the things that concerns me is if you look at some of the indices and surveys that are out there that look at how companies are doing, how the private sector is doing, for example, in facilitating access, and the one that comes to mind is the Access to Medicines Index, because it's one of the more known, but there are many, because believe me, we have to respond to those surveys, and I can tell you there are many. What troubles me about those evaluations or those indices is that they really pit company against company. It's how is company A doing versus company B? And none of them look at how are company A and B working together to achieve a common goal. So that's not evaluated. What's evaluated is, well, what are you doing that's different or better than your competitor? And I do believe that competitive incentive causes companies to do more. So I do believe that. But I worry that it's at the expense of what can be achieved in a broader and greater way by making it a collaborative effort. Coping with changing players, changing problems, changing priorities. We talk about the importance of sustainability and having a plan. We also talk about community ownership and how to set these partnerships up. I think you have to keep in mind that things change. Partners change, governments change, players change, priorities change. So I think we have to be a little bit careful not to be static in our thinking. I think Sir George said something about energy, the energy of partnerships. Well, that energy is constantly in motion. I think we have to be prepared to respond to that as it's required. I'm just going to mention very quickly a fourth C, and that's compliance. I think it was Susan yesterday who talked about trying to get a press release approved when corporations are involved, and what a nightmare. She was more polite than that, but I can tell you it's a nightmare. I think it's important to recognize that, especially for the healthcare industry, we operate in a highly, highly regulated environment. And I think Jack talked about this a couple of times over the last 2 days. So every T has to be crossed, every I has to be dotted. And I publicly apologize for how much we drive all of you crazy with the need to review things multiple times just to make sure that we're putting something out there that we are totally comfortable with. But that is an obstacle that can be a challenge. And it's just something that we're all dealing with. So lastly, when we think about how do we apply what we know going forward in the role of the IOM Forum, I think we need to continue to share best practices. I think, workshops like this are really, really useful. I also think there's untapped value in our failures. A couple of people have said over the last 2 days that when they've tried to document failures, no one will talk to them. And that's because most organizations don't want to admit, including Merck, when things have not worked well. But I don't think that should stop us. I do think that there are ways to document failures, to tease out the lessons learned from failures, even if you do it in an anonymous way, that we could all learn a lot from. And I think that's one area that we haven't even scratched the surface on. The link between health and security, and again, these are just things that sort of resonate with me in no particular order. So the link between health and security, we're starting to see that more and more, but I think that's another area where there's been very little done to document, what that looks like, why that's important, how we can take on that challenge. I'll go back to the trust and respect issue. That's one where if we can crack the code on that and truly forge trusting partnerships, I think we can achieve great things. I don't know if that's a good fit for the forum. I don't know if there are any behavioral psychologists that are part of this group that can help with that. But I do think that's one area that everybody recognizes that it's important, but I don't know that we're honest enough with one another to put the real issues on the table. I think those issues get bypassed. And then lastly, I think Wendy made this point, and I just want to endorse it. This idea of going beyond where we are today. There's so much more that can be done through partnership. And I think it behooves us to recognize what's untapped, that we can be more creative, we can be more innovative. We shouldn't be satisfied with where we are now in terms of partnerships and the lessons we've learned to this point. When we look at health systems, and broader partnership, that's an area where I think we can do a heck of a lot more, probably more challenging, but I think the reward at the end will be so much greater. Thank you.